Before administering any medication to your patient, there are some important checks you need to make, and these checks are known as the 10 rights of medication administration, and they help healthcare providers prevent medication error. In this video, we'll go all through 10 of them with practical examples you can remember in both your exams and your clinical practice. Now, let's get started. Firstly, we'll be looking at the right patient. So before administering any medication to a patient, you should first ask yourself this question: am I giving this medication to the correct patient? So never assume you have the right patient just because you can recognize them through their faces or you know their room number, and always use at least 2 identifiers, such as patient's full name or patient's date of birth, and always compare them with the medication order. For example, imagine 2 patients have the same surname and they are both in the same ward. One of them needs insulin and the other does not need insulin. So simply looking at their surname to give medication, you could easily give the medication to the wrong patient. That's why checking 2 identifiers is very important. And what if the patients cannot tell you their name, like if they're unconscious or unable to speak? So in this situation, you need to follow your hospital or your facility's identification protocol and use available identifiers rather than guessing. So next is the right drug. Now you've confirmed the patient's name. The next question to ask yourself is, am I giving the correct medication? So before administering any medication, you should carefully check the medication label against the medication order or against the doctor's prescription. For example, firstly, there are 3 things you need to check: when you take the medication from where it's stored. Secondly, when you're going to check it is while you're preparing it. And thirdly, immediately before administering that medication to your patient. So during these 3 instances, you need to check that your medication. So this might be repetitive, but it is a very good way to catch medication errors before they reach the patient. For example, some medications have names that look or sound familiar, such as hygialixin and hydroxin. Their names are very similar, but they are completely different. So don't just glance at a medication and assume they are correct. Always check 3 times when you take it from its storage unit, while you are preparing it, and immediately before you administer it to your patient. Always read the label carefully. Then next is the right dose. This involves medication calculation. So before administering any medication, make sure that the prescribed dose is the same dose with what you are actually preparing. And if the calculation does not look right, do not administer that medication to your patient. Or if you are still in the process of preparing it, you should stop. And then always recalculate medication orders. And then if you are not sure or when necessary, you should also ask another qualified healthcare professional to check it with you. For example, 0.1 milligram and 1 milligram are similar, but they are not the same. And one is 10 times larger than the other. 0.1 milligram is 10 times equal to 1 milligram. So a misplaced decimal points can turn a correct dose to a potentially dangerous dose, which can be life-threatening and detrimental to patient's health. You should also make sure that the dose matches a particular patient while considering factors like the patient's age, weight, patient's medical condition, and should be in accordance with medication order and guidelines. The 4th right of medication administration is the right route. So the route simply means how the medication enters the patient's body. For example, a medication can be given orally, intravenously, intramuscularly, intradermally, subcutaneously, or topically. The route matters because it can affect how quickly and strongly the medication works. So before administering a medication, you should check that the route on the order matches the medication you are holding. Giving a medication through the wrong routes can be extremely dangerous and life-threatening. For example, a medication intended for intramuscular administration can never be given intravenously. The right medication given by the wrong route is still a medication error and is life-threatening to a patient. The fifth right is the right time. Medication timing is important and should never be given when convenient. Some medications need to be given at specific times to maintain a desired level of medication in the body, to avoid drug interaction, and to also achieve the intended effect the medication was designed to achieve. For example, imagine a patient has an antibiotic prescribed every 4 hours. If you keep giving it at random times, the medication level in the body may not remain where it needs to be. So always check patient's medication schedule and follow your facility's policy. And if your medication is late or missed, you should follow appropriate procedure and document what happened and why it happened.